The following portion of Good Day PA is sponsored by WellSpan Health. Dr. Katie Young is joining us to share about their Gene Health Project. What is the Gene Health Project and why is WellSpan doing this?
The Gene Health Project is a free community health research program that utilizes genetic screening to inform patients if they're at an increased risk for certain conditions, such as breast or colon cancer, as well as heart disease. WellSpan initiated this so that way we can take a proactive approach to healthcare.
Very good. And this is the time of year when families are getting together. Maybe you don't think this is what would be the topic of discussion, but it is a good opportunity, right, to talk about genetic health.
The holidays certainly can be an ideal time for us to talk about these things, as often families are gathering together and sharing just general life updates. Sharing health information certainly can be a difficult conversation to have, but it is very important so that way family members can make well-informed decisions regarding their own care.
I agree, because sometimes I'm at the doctor, or my child's at the doctor and says, do you have a family history of, and I honestly don't know the answer. So what is a good way to start the conversation so it doesn't feel so awkward?
Sure, and that's a great question, and it's not one size fits all. And so ultimately, I think if we frame it in the regards of an act of care, that can allow us to have a very candid and honest conversation with our family members, so that way they can be well informed and make actionable steps towards addressing their own care.
So if you're starting the conversation, you probably understand at least a little bit about the importance of genetic screening, but for the ones on the other end, they might be a little hesitant. What would you say for that?
So being hesitant is certainly valid. I think there's a lot of information out there about genetics, but this test is at no cost. It's also non-invasive, and we are able to take clinically actionable steps, meaning if we identify something putting someone at an increased risk, we do have management recommendations to address that, such as starting screening earlier or doing it more frequently.
I want to backtrack. You just said there's no cost for this?
Correct. There's no cost to participate in the Gene Health Project.
Wow, that is so interesting. What an opportunity, honestly. And what role does early prevention play, or early detection play in preventing health conditions?
Prevention and early detection are essential because it gives us more time to take clinically actionable steps. And so often the earlier we catch something, the better the prognosis. So knowing this information ahead of time allows us to be able to do so.
How can somebody enroll in this? What's that process like?
That is a good question. And so to participate, they can visit wellspan.org/Gene Health Project. From there, they will be prompted to our consent forms. Once those have been signed, they can schedule their blood draw, or if they would prefer to coordinate a saliva collection, that's also available now. And then from there, in a couple of weeks, we should have their genetic testing results, and that will populate into their medical records, so that way patients as well as their care team are aware of any actionable steps we need to address.
I should ask, do you need to be a WellSpan patient? Can you be involved with another, hospital or health system?
You do not need to be a WellSpan patient. However, it is coordinated through WellSpan, so
Sure.
you will receive some contact from us, but it is open to the entire community.
That is terrific. What an opportunity. Thank you for I'm going to do this. I'm going to sign up today. I really am, because it's such an opportunity. Why not? Good to have you.
Thank you for having us, and we are here to answer any questions you might have.
Very good. Thank you to WellSpan Health. The previous portion of Good Day PA was sponsored by WellSpan Health.